Hey there, smile champions. Ever wonder if you're really brushing your teeth the right way? Or if that expensive toothbrush is actually worth it? Well, today, we're diving deep into the world of dental hygiene to reveal the best brushing techniques, the biggest mistakes you must avoid, and the essential tools you need for a healthy, sparkling smile. Let's go! First things first, why does dental hygiene even matter? Well, did you know that your mouth is home to over 700 species of bacteria? Some are friendly, but others, not so much. Poor oral care can lead to plaque buildup, cavities, gum disease, and even serious health conditions like heart disease. So keeping those pearly whites clean isn't just about looking good, it's about staying healthy too. Now, before we get into the brushing techniques, let's talk tools. What do you actually need for the best oral care routine? Here are the essentials. Toothbrush manual or electric? Soft, medium, or hard bristles? The answer? Always go for soft bristles. They're gentle on your gums while effectively removing plaque. And while manual brushes work just fine if used correctly, electric toothbrushes make it easier to get a deeper clean. Toothpaste. It strengthens enamel and helps fight cavities. If you have sensitive teeth, look for a toothpaste specifically designed for that. And avoid whitening toothpastes with harsh abrasives that wear your enamel over time. Floss. Brushing alone cleans only about 60% of your teeth's surfaces. Flossing gets into those tight spaces where food and bacteria love to hide. If regular floss is tricky for you, try floss picks or a water flosser. Mouthwash. It's not a substitute for brushing or flossing, but it can help kill bacteria, freshen breath, and strengthen enamel if it contains fluoride. Just be careful with alcohol-based mouthwashes. They can dry out your mouth, making bad breath worse. Tongue scraper. Your tongue harbors a lot of bacteria, which can cause bad breath. Scraping it daily can keep your mouth fresher for longer. All right, now that we've got the right tools, let's talk about how to actually use them. Here's the gold standard brushing technique recommended by dentists worldwide. Position your brush correctly. Hold it at a 45-degree angle to your gums. This allows the bristles to sweep under the gum line where plaque hides. Use gentle circular motions. Many people scrub their teeth like they're scrubbing dirty dishes. Don't do that. Harsh brushing can damage enamel and irritate gums. Instead, use small, gentle, circular motions. 2 minutes twice a day. Yes, 2 full minutes. Divide your mouth into 4 sections and spend 30 seconds on each. Try using a timer or an electric toothbrush with a built-in timer. Don't forget your gums and tongue. Gums need love too. Lightly brush along the gum line to remove hidden bacteria. And don't forget your tongue. It's a major hotspot for bad breath-causing bacteria. Think you've got your brushing routine down? Well, let's make sure you're not making these 5 common mistakes that could be ruining your dental health. Brushing too hard. Scrubbing won't make your teeth cleaner. In fact, it can wear down enamel and cause gum recession. Using the wrong toothbrush hard-bristled brushes might sound effective, but they're actually too abrasive for your enamel. Always choose soft bristles. Skipping the back teeth. Your molars do most of the chewing, so they need just as much attention as your front teeth. Make sure to reach all areas of your mouth. Rinsing after brushing. Wait, what? Yes! Rinsing with water immediately after brushing washes away the fluoride from your toothpaste. Instead, just spit out the excess and let the fluoride do its job. Not replacing your toothbrush. Your toothbrush has a lifespan of about 3 months. If the bristles look frayed, it's time for a new one. Brushing is just one part of the equation. Here's how to take your dental care to the next level. Floss daily. Yes, every day. It removes plaque between teeth where your toothbrush can't reach. Use fluoride mouthwash. A fluoride rinse helps strengthen enamel and prevent cavities. Just don't eat or drink for 30 minutes after using it. Watch your diet. Sugary foods and acidic drinks weaken enamel and lead to cavities. Drink plenty of water and eat crunchy fruits and veggies to help clean your teeth naturally. See your dentist regularly. Professional cleanings remove stubborn plaque and detect issues early. Aim for a checkup every 6 months. So, now that you've got the ultimate guide to dental hygiene, tell us in the comments, what's one mistake you used to make when brushing? Let's learn together. Happy brushing. Your teeth will thank you. See you next time.